Congratulations, doctor! Your patient's report is now ready. This guide will consist of our suggestions to help the patients derive most value from this report. There will be 3 parts. 1. The introduction. 2. The report. And 3. The closing. Introduction. Introduce your name, position, and intention. To verify the identity of your patients, ask for your patient's name, their registered address, or date of birth. If the person is their guardian, ask for their name and address or date of birth and match them with the informed consent form. Repeat this process if you are speaking with the caretaker. Now, onto the report. Explain that this report does not substitute professional medical advice. Just one of the tools to determine better health decisions from a doctor or physician. Explain that your patients can't take decisions for themselves, that the medical decisions would come from us. Explain that this test does not mean that you have risk for these diseases. Instead, these are insurance that if you do, you will know what to do and which drugs to take. Explain symbols of each follow-up action and the meaning of them. Follow standard dosing, increase starting dose, decrease starting dose, increase monitoring, and changing your prescription completely. Explain the meaning of recommendation caveats of how they are required conditions and situations where the guideline is relevant, and explain each of their symbols. Explain the levels of scientific evidence and their meanings available for their respective clinical recommendations as presented in the report. Emphasize that this test result is personalized, so it can't be used by others even if they're blood-related. There are 2 kinds of report, the general and the detailed one. Mention and explain the 5 genes that have been tested in the big picture. Explain why we chose these 5 genes and 38 drugs. Explain what is phenotype and metabolizer profiles in the most easiest or simplest way possible. Explain the important or highlighted drug-gene pairs taken on the pre-GC test. Now the report part is done. For closing, ask if there are any questions from them. You can tell the patients if they have any other questions you can follow up through our mobile app. Simply navigate to the chat feature, and you will be connected to help immediately.